Live from Times Square and Central Park, this is GMA.
We're going to move on to the GMA cover story. It's a health alert about skin cancer. A new study indicates having a parent or sibling with melanoma increases your risk of developing all skin cancers. Want to talk about that with our dermatologist, Dr. Whitney Bowe. Great to see you again, Whitney.
Thanks for having me.
Tell us about this study.
So we've known for a long time that if you have a parent or a sibling with melanoma, it puts you at an increased risk of developing melanoma. But this new study suggests that it also puts you at an increased risk for other forms of skin cancer, things like squamous cell carcinoma and basal cell carcinoma. And those can look completely different from a melanoma. So it's just so important to know your family history. When you go to see your derm, you've got to tell your derm if you have anybody in your family who's been diagnosed with a melanoma, because they're going to be scanning your body not just for melanoma, but based on this study, your derm is going to basically be on the hunt for any sign of any skin cancer.
And what else should we be looking for on our own?
So we want to look for melanoma in particular, the A, B, C, D, and E. So A stands for asymmetry, meaning that these two sides of the mold don't match. B has to do with the border. If the border is irregular, that's concerning. So C is color. If there's multiple colors, different shades in the same mole, that's cause for concern. So D is diameter. So George, we used to tell patients look for something larger than the size of a pencil eraser. Quite honestly, nowadays we're kind of catching them even earlier than that. So I stress E. E stands for evolution or change. Anything that's bleeding, itching, changing, schedule an appointment.
Do not ignore it. Go to your dermatologist.
Yes, thank you.
What other ways to prevent?
So sunscreen, obviously SPF 30 or above. Look for the words broad spectrum and reapply. So every 2 hours you've got to reapply, and you have to use enough. Most people need about this amount to cover their skin, and they use about half of what they need. So you're not getting the SPF on the label. But also sun protective clothing. So a broad-rimmed hat, sunglasses, long sleeves, and ideally you want to seek shade when the sun is at its peak. Take a little siesta.
It's not a bad idea. Important reminders. Thanks for coming in today. Let's go to Cecilia.